Welcome once again to SoCo Chat, a podcast where we hear directly from county leaders, discuss the latest news, and talk about all things concerning our beautiful corner of California known as Sonoma County.
Welcome back to SoCo Chat. I'm Matt Brown, Deputy Communications Manager for the County of Sonoma. Thank you for joining us. The Sonoma County Department of Health Services is one of the largest and most important county departments, touching everything from homelessness to pandemic response to the opioid crisis. Behavioral health, environmental health, public health, even the Sonoma County Animal Shelter all fall under this sprawling department. The director of the Department of Health Services, Nolan Sullivan, is 5 months into the job, and he joins us today to talk about his vision for the department. But before we get to our interview, I want to start with our trivia question. Our question today is, according to the DHS Community Health Dashboard, what is the average life expectancy in Sonoma County? If you know, call us at 707-565-2242 or email us at publicaffairs@sonomacounty.gov. If you are correct, you'll be entered into our weekly drawing for a chance to win a SoCo Chat coffee mug. So with that, let's get on with our discussion. Welcome, Nolan. Thanks for being here.
Hey, Matt. Thanks for having me. I'm very happy to be here.
Great. Well, I just, as we said in the intro, you've been here for 5 months.
Yep.
Tell us a little bit about your background. How'd you end up in Sonoma County?
Yeah, great question. So I think I started on April 2nd, so I think I'm just starting my 5th month now, which is fantastic. Prior to my time here in Sonoma County, I spent actually 17 years in Yolo County. And so Yolo County has a health and human services department, and it's the two departments combined. And so the last 5 of which I spent as the director there. So kind of came up on the eligibility side, a lot of work with Medi-Cal, CalFresh, homeless programs, really started getting into the public health and behavioral health worlds the last couple of years, and really enjoyed that. So that's where I spent the bulk of my career. Simultaneously, I like to say that I'm a recovering elected official. While I was working in Yolo County, I also served as a school board trustee in the city of Vacaville and then a Vacaville city councilman for some time as well. So really trying to kind of get involved in my local community. Grew up, born and raised in Vacaville, pretty much spent my entire adult life there. Had kids there. My family's still there to some degree. Was really involved in my local community, kind of nonprofits and a variety of different things. And to be honest, I don't totally know how I ended up here. I like to say that the county has a really talented recruiter. And I got cold called one day and they, asked me if I was interested in the opportunity. And I said no, at the time, and, came back home and, talked with my wife, about a variety of different things. And somehow it came back up, and, we've been coming to Sonoma County for vacations, and I've got some family up here in Healdsburg for decades. And life's weird, like you never really think you're going to make a big shift or a big move. And, throughout that conversation, she convinced me to call the county back. So I called about a week later, and luckily they were able to sneak my application in there. And it was probably one of the most intense interview panels that I've been on before, or been interviewed by, although I haven't had a whole lot of interviews in my adult life. Lo and behold, I'm here. So really excited to be here. I think I have a passion for serving the populations that we serve here. And I think I bring a skill set that the department really needs right now, and some fresh energy and a fresh perspective. Big shift for us. So we sold the house, moved the whole family. In fact, I just got my keys to my new house on Sunday. So I'm officially a Santa Rosa resident now, which is great. So I've moved my kids and my wife and my dog. And we're all really looking forward to starting our life here in Sonoma. And so far, so good, as we enter month 5. So there's a lot, but I'm enjoying it.
Yeah, well, you've got great experience, great background, and we're just really lucky to have you here in Sonoma County.
Thank
so,
you.
yeah,
Thank
no. And you're, almost 5 months or just started your 5th month here at Department of Health Services. It is, as we said, a vast, sprawling department. How's it been so far running the department, and what are the biggest challenges you've come across?
There's a lot. I mean, it's interesting, and I try to sort of dissect the difference between Yolo County and Sonoma. So Yolo, we were kind of talking before the show today, kind of similar in terms of the makeup of the county. It's a little bit rural, a little bit urban. It's got kind of a mix of different things. Sonoma is very similar in that respect, although larger, right? It's got a much bigger population, much bigger geography, tons of towns and hamlets and little villages and things that I'm getting to know. But I think the work in the agency is just really heavy work, right? I mean, no matter what you're dealing with animal welfare and how we treat, our furry friends here in Sonoma County. You're dealing with folks that are unhoused that really need some help. You're dealing with folks that are having mental health crises or are suicidal or have substance use issues that really need to get treatment, or things on the environmental health spectrum, chemical spills or inspections or keeping the public safe when they eat at restaurants. And so the work, there's just not really an easy day, right? I mean, there's some new emergency every day. When I say emergency, it usually is some sort of 5-alarm fire of sorts. And so far, so good. 740-ish employees, and we've got 5 or 6 different buildings, locations, sites, et cetera, et cetera. So I really pride myself on knowing my staff, knowing my teams, and being available. So I think the hardest part so far has just been like time in the day, time to meet folks, getting to know folks, remembering people's names. As the director, everyone knows your name, but you're really trying to kind of get to know their names and know about their families and their kids and their backgrounds and how they work. So that's been the hardest part, I think, so far. I think Sonoma County also has a really robust nonprofit network. I mean, tons of nonprofits that are doing really great work. So getting to know all those nonprofit leaders and different folks, sort of navigating my relationships with other local governments, meeting different mayors or city managers and really trying to be helpful and provide value. And then the board, they each have their own personalities and expectations and districts and needs. And so really making sure that I'm serving them to the best of my ability. And then kind of getting to know my new bosses. So I've got the CAO and I've got the deputy CAO, and they've been fantastic. So it's just, when you work somewhere for 17 years and you know just about everyone and everything, the work we do is often built on relationships, right? It's knowing who you can call to solve a problem or call in a favor or connecting different organizations and groups. I got to rebuild all of that. So I didn't really have that on my bingo card per se. And that's something that I'm trying to kind of work through now. So far, so good. It's just every day is jam-packed with meetings and check-ins and kind of ride-alongs. And then every day is also sprinkled with a variety of different emergencies that demand all of your attention. So,
yeah, you're staying pretty busy, sounds like.
Very busy, yes, 100%.
You need to clone yourself so you can get more done or something.
That would be ideal, and that's the thing. If I could have like 3 or 4 more of myself, I think this would be phenomenal. So
absolutely. Well, I do know that one of the main big challenges in public health right now is the cuts to federal funding. We're talking public health grants. We're talking cuts to Medicaid, nutrition programs like SNAP and WIC. Do you have a sense of how these federal changes are going to impact people here locally?
That's a great question. I think that's the question on many folks' minds, including our board, our CAO's office, the public. I think the way that federal funding works, and I guess I'll start right off the bat with, our department has about 64% of its budget is state or federal funded, right? So that's a huge deal. So, a lot of other departments are mostly general fund. They've got a couple grants here and there. So when we have changes to either the state budget or the federal budget, it makes a big impact in our department and the services we can provide. So at least in respect to today's conversation, looking at the state first, the state is not in a great position. So we know the state has a multi-billion with a B dollar deficit. They're hurting. They're trying to balance their budget. They're already reducing, cutting, trimming, shaping programs. And we kind of knew this before the current federal administration was kind of making some of the changes they've made. So the state is already kind of hobbled, right? And then you have the federal government, and I think it is not untruthful for me to say that they just don't prioritize many of the things that maybe historically we have prioritized in the health and human services field, or at least the way that we do business. And so whether it's on the public health side or the homelessness side or the behavioral health side, which is primarily Medicaid funded, there's a new philosophy for how we do things, right? So the problem that we have in terms of boots on the ground here in Sonoma is the way the funding rolls out. So Congress and the president will enact their budget, right? And that goes through the whole process. We just went through that whole kind of circus, if you will. And so the budget has been passed, and the big, beautiful bill, or H.R. 1, as they say, is now the law of the land. Then you have all these federal departments have to figure out what the heck does that mean for us, right? So they have to go through their budgets, their programmatic changes. They have deep analysis there, and they start making their programmatic plans. So it takes them a couple months really to get a grasp of what's in the bill, and we all hear about the things that are hidden in there, or the pork barrel, or all these different things. It takes some time for the federal departments to really assess, like, what does this actually mean for this federal department? Simultaneously, they've made all sorts of changes and layoffs and staffing cuts and changes in the federal departments too, so that further slows things down. Once they have an assessment or understanding of what that means, they then pass that funding through to the states. So the 50 states in the United States, some states actually run their own program. So in some states, their version of Medicaid is run by the state. In the state of California, our Medi-Cal program, which is Medicaid kind of in California, is actually run by the 58 counties. So what happens then? So the feds finally give the states, here's your number, here's your allocation, here's your budget, here's your cuts, here's your changes. So then the state has to take some time to think about, well, what does this mean for us, right? And so the state has the option to backfill, they have the option to supplant or change or adjust to some degree. So the state then really has to do a deep analysis and kind of go through things and figure out kind of what they're going to do. Lastly, the counties. So the 58 counties then get their own allocation at some point in time. So the problem is, from the day that HR 1 hit the news feeds, and we can all read what was in the bill, the day it passed, it really takes 6, 7, 8, 9, 10 months for us to know what that actually means here in Sonoma County, right? And so I know folks want answers. I know there's a lot of anxiety. My eyes or my attention is really focused on the next state budget. So the next governor's budget, probably coming out in April or May next year, I think we'll have a much clearer picture of what the cuts or changes will be from the federal government, but also where the state can backfill or can support or will support kind of keeping programs that we've had in place. So I know it's not a great answer. I know folks want answers now. In the health and human services world, we're really not going to have solid answers probably for 6, 7, 8, 9 months.
Yeah.
And again, really kind of keeping my attention on that next California budget, because I think that's really where the rubber's going to meet the road.
Yeah. So we know changes are coming. We just don't know what they are yet, and we will figure those out as
and we know they're
come.
not going to be great, right?
Yeah.
I mean, many of our programs are based on Medicaid, right? A lot of the homeless services that we have, the housing services that we have, the behavioral health services that we have, substance use services. California has made some pretty dramatic changes to Medi-Cal over the last couple of years, allowing for the payment of housing for the homeless, allowing for the payment of case management, allowing for the payment of nutritious meals to be added to the Medi-Cal benefit. A lot of that probably is in jeopardy. And so we've made these massive expansions to really combat the high cost of living and poverty in California. And we've made some serious gains, but I think a lot of that we know is at jeopardy of being cut. So my co-partner over at HSD, Angela, she's got to deal with all the regulation changes, all of the different things they're adding. By just saying we want to add work requirements to a program doesn't make it done, right? It takes thousands of hours of analysis and procedures and policies to be built. It's got to be programmed into the statewide system. We have to train hundreds of thousands of workers how to apply these new rules, and then train all of the folks that are on those programs. So things like this that sound fairly simple are actually Herculean undertakings and will take some time.
Yeah.
So, but at the end of the day, at least from my lens, and this isn't a political statement, these are not going to be good changes for the people that I serve in Sonoma County, and they're not going to be good for the folks typically the hardest hit or the lowest income or the most in need in Sonoma County, unfortunately. But
Right.
That's the direction we're heading.
Understood. One thing you have here in Sonoma County under your portfolio is the animal services, Sonoma County Animal Services. Tell me what's going on with the animal services. I think there's some facilities upgrades, or what do you want to mention
I'm so
about that?
glad you called this out. So this was also not on my bingo card for 2025, was to be over the animal services program and the animal services shelter. And so a bit unusual, I think, here in Sonoma County. Sonoma County Animal Services lives under the Department of Health Services. And to be honest, it's probably one of my program favorites. It was one of the first tours that I made. And I really think that, how a society treats its animals really is emblematic of that society's value for life. And I just couldn't be happier with the team out there. A couple big updates from the animal services side of the house. The first is we actually the first in Sonoma County, all of our animal services officers, the fantastic men and women that do these really hard jobs, are now state certified, which is a huge accomplishment for us. So just big thank you to that team. Big congratulations. Took lots of studying. I think it's 80 hours of curriculum and a test, but really proud of Brian and the team for kind of getting that knocked out of the park. Secondarily, if you've been to the animal shelter, A, it's one of the cutest places you've ever been to, but B, it's also one of the most depressing. And so it has not had a major makeover or a major upgrade or remodel in at least 15, 20 years. We do not have the capacity right now to keep up with the volume of animals that we have. And honestly, the way the shelters are designed presents some serious problems for the dogs and cats. We have a really hard time dealing with infectious disease just based on the way the kennels are formatted. Unfortunately, with climate change, the kennels often struggle with the heat in the summer and the cold in the winter, and it just really is not the place that we want to treat our furry friends. And so the facilities team and Brian, as well as other folks, have been working on a variety of different options to really kind of upgrade the facility, have a better adoption facility for folks to come visit and pick up pets, and really kind of show those animals the love that I think they deserve. So we have a plan that's kind of like mild the wild. We have a variety of different options. It starts out at about $500,000, goes all the way up to about $14 million, which obviously right now is not great during a budget crisis with all sorts of other things. But I have a feeling there are some big-hearted animal lovers in Sonoma County. And so we're hoping to launch a capital campaign here pretty quick and to try and fundraise some of the funding to really get us over the top here. We potentially have some matching funding from the county. We might have some funding from a particular supervisor's office to help us get started. But we're really hoping to find some folks that want to invest in this. The program is absolutely beautiful, and we have everything from guinea pigs to cockatiels to dogs, cats, you name it. I mean, we got horses, chickens. So please, if you're looking for anything, and if you're like me, you can't make a visit out there without taking something home. So my wife has forbid me from visiting over the next couple months.
We've had some of the animals on our show. In fact,
they're amazing.
It's great. I love it. Yeah,
so we have an abundance of kittens right now. So if you're looking for a kitten, now is the time. We've got some really cute little buddies out there. But we're hoping in the near future we'll launch this capital campaign. We'd love to have maybe come back on the show, have Brian. Maybe we'll bring some dogs and cats.
Yes, that'd be
great. And just
great.
talk about how we can show those little buddies some love. So
Absolutely.
Big shout out to that team. It's a joy to have under my my supervision. And I'm just so impressed with the way that they treat the animals of Sonoma County.
That's great. Well, let's talk about some other parts of your portfolio. Let's just go through the different divisions in the department. So let's start with behavioral health.
Yeah.
One of the big things there is the Measure O funding for mobile support teams that you launched countywide.
Yeah.
Tell us a little bit about that.
Yeah, dialing it back 2 steps, Measure O is something that I'm kind of getting up to speed on. And to be honest, it was actually kind of a variable in me deciding to take this job, right? So homelessness and behavioral health across the state of California, across the nation, have been seriously underfunded for decades. And the fact that this community saw fit to pass a tax measure to support the most in need, the lowest income, the most vulnerable in our community was a big reason why I decided to come here. And Measure O produces a pretty sizable amount of capital every year to really support very specific behavioral health needs and homeless needs. Homeless needs being very small statutorily, but in our community. And so, thank you, Sonoma County voters, for that gift. And I really hope they choose to renew this in the future because it does some wonderful things for our community and for the folks that need it. Secondarily, the behavioral health system could always use more revenue, right? And so even with Measure O, behavioral health is really costly. It's very expensive to house someone. It's very expensive to pay for substance use treatment, a psychiatric hospital, all sorts of different things. It's a really costly system. So today in Sonoma County, and Sonoma County was kind of a pioneer. They were one of the first in California to really have mobile crisis. And so it's interesting because even in my old job, I'd always kind of heard about like Sonoma's doing this and Sonoma's doing that. And you guys were kind of this amazing, I should say we guys were this kind of really early pioneer in expanding the way that we treat crisis throughout the community. And so the good news and bad news about this whole situation is we built these really great programs way before anyone else in the state of California. And so you've got your in-response program out of Santa Rosa, which is sort of like the industry, I call it the Lamborghini model. It's fantastic. It's got some really great features. You have the SAFE model, which then operates in Petaluma and a couple other parts throughout the county, Cotati and Sonoma State, which is fantastic. And then we have a really great internal team, the mobile response team, that actually goes kind of everywhere else in the county.
And these are first responders who respond to mental health or behavioral health crises
100%,
with that don't involve law enforcement.
Exactly.
Yeah.
So it's sort of like a paramedic for mental health, right? And so the idea is to send the right person or the right tool for the job. In some cases, we respond with law enforcement, depending on the scenario and safety risks and things of that sort. Our preference, though, obviously, is to respond without law enforcement if it's safe. And that really is the way that we, try to connect people to services. So again, the good news is we have 3 really great systems that have been up and running for a long time, and they're doing really, really well. The problem is they're very expensive. So the state of California about 2 years ago finally got with the program and basically made it eligible and mandatory for counties to offer 24/7 mobile crisis support across the state of California. Super hard undertaking. There were only maybe 10 counties that were doing something sort of similar at the time, and it has all sorts of requirements and check boxes and things you have to meet. The really cool thing, though, is if you actually meet those requirements and you offer the service based on the way the program is required, you're compensated pretty heavily per instance per Medi-Cal recipient. So you can get almost $4,500 per instance per call in reimbursement for Medi-Cal recipients. Obviously, not everyone on the county is on Medi-Cal, so it's going to be about half your calls. But it's a great way to build stable revenues to support these programs. So today, none of the 3 programs are Medi-Cal billable compliant. And so my number one priority, is to all of them need to be billing Medi-Cal, right? And so that's rule number 1. Number 2 is you have 3 systems with different outcomes, different reports, different data. It's really hard to compare an apple to an orange to a peach, right? And so we need to have similar data metrics. We need to really kind of get on the same page, make sure we're comparing the system across the board. And then lastly, where Measure O can be helpful, we really want to get Measure O out to our city partners, right? And I think this is a great example of how a county, a city, and in some cases a nonprofit can partner, and then we use Measure O to kind of fill those funding gaps. So my number one goal is really making sure that we're billing Medi-Cal to the absolute maximum, building stable teams that will last long past my tenure here in Sonoma County. Secondarily, it's to build some consistency and some stability for these departments. So I'd like to have long-term multi-year contracts so they can count on those revenues. They can count on those programs. We know our city partners right now are hurting. The county probably won't be too far off. We've got layoffs in certain cities and budget deficits and all sorts of different things. This is a service that we want to preserve, and it's working really well. So we are super excited to be able to give a pretty large, almost $7 million this year to support those programs in our city partners, with the notion, though, that we're going to work towards these longer-term, more sustainable, more consistent programs in the future, and ideally provide better services to all of Sonoma County, and also do it in a way that's more fiscally responsible.
That's great. Another division you have, homelessness services. That's also under your purview.
Yeah.
The PIT count, the point in time count that counts the number of homeless individuals on a given day. We just got results of that. That's the lowest number of homeless individuals since the PIT count has started. That
Yes.
seems like a positive development.
It's a huge positive development. So last year at this point in time count, for folks that don't know, it sounds crazy, but this is the way it's done. 1 year or one night a year, a group of volunteers and teams gets trained, and they literally go out and kind of hand count and do a census of folks that they view as homeless. It's not the probably most effective way to do things, but it's the way that HUD has us do it. It's the way that it's done throughout the 58 counties. There's ways to kind of sync that up, and the team's done a really good job making that as accurate as possible. But that really is our best sort of guess as for the homeless population. So we are down from about 2,500 in 2024 to 1,900 this year, which is the lowest it's been in 5, 6, 7 years. And to be honest, it's about half of what it was back in 2011. And it's even lower. It was about 5,000 at one point in time here in Sonoma County. Again, we're down under 2,000, which is a pretty phenomenal feat. Simultaneously to the PIT count, we count the number of affordable housing units, interim housing units, shelter units we were able to add to the system. We were able to add over 400 new units last year. And when I say we, I'm not saying just the county. The county's a partner, but we work with our city partners. We work with our nonprofits. We work with the federal government, the state government. It's a continuum of care, a COC. And so we're all kind of in this together, working towards this together. So huge pat on the back for all of those COC partners. Again, probably the biggest shift that we've actually seen in the point in time count in Sonoma in 5 or 6 years. And again, over half reduction from 10 years ago, right? And so I think everyone remembers the time when you were driving around wherever and there were encampments everywhere, and we've made a lot of progress.
Yeah.
The bittersweet part of this, though, is that we know that with the cuts to Medicaid, we know that with the cuts that are probably coming to HUD, that progress is probably going to be short-lived. A lot of that was also supercharged by ARP, by CARES, by some of the money from the pandemic, and so all of that has sort of run out. So the sad part is we all recognize we can solve homelessness. We know how to do it. We know the formula. We know it's effective, but it takes resources. And unfortunately, my crystal ball looking forward the next couple of years sees those resources really draining. And so I suspect we're going to see that number climb back up the other direction. But it does show what a community with resources and some intentionality and partnerships can really do. And so I hope Sonoma County residents are really proud of all the folks in the COC, whether they're city, nonprofit, or county, that have really made some major progress in getting people housed and helping them on their path to really healing and being successful.
Well, great job turning things around on that division. On the administrative side, another thing you've managed to turn around, the department has taken some heat in the past for the time it takes to pay service providers. Sounds like that's not quite the issue anymore. We're
cranking it down. We're cranking it down. So we have been in the paper a lot for really awful things, and we have recognized that, and we're ready to get in the paper for some really good things. And so we are trying to get our contracting time frame down under 25 days. We're getting darn close to that on a variety of different contracts, and we have been on time on a variety of big contracts this year that we've made some major progress. So thankfully, before I got on board, the CAO's office had enlisted a couple consultants to kind of study some things, as well as a group called MRG to really do a kind of a deep dive on the issues in the department. We've got lots of issues around in contracting and a variety of other things. And so we've got a pretty solid roadmap. And frankly, the agency, the tenure is young. We'll talk about that in a second, I think. We've got some really smart and capable employees at DHS. And so we have kind of a dream team right now working on revising our contracting process down from 1 million confusing steps to like 20 streamlined steps to really kind of help expedite that process. We know that getting those contracts out the door gets dollars in someone's pocket that gets services for a Sonoma County resident. So we're really trying to get that dialed in. It's a work in progress, but we have made some very successful strides forward, and we are hoping to hit that deadline of under 25 days within the next 6 months or so. So a big shout out to the admin team. It's a heavy lift. We have thousands of contracts, and it sounds like, why is this so complicated? If you ever want to see a complicated contract, look for a Medi-Cal billing contract in the behavioral health space, and it'll make your head spin. But the team is really making some strides and some good progress there. So more to come. We are also starting up a contractor roundtable. We'll give it some sort of flashy, cool name, but a contractor roundtable once a quarter where our contractors or folks that prospectively want to contract with the county can come and get time with the executive team, come and get time with me, come and get time with our admin team, our fiscal team, our contracts, air their grievances, share their kudos, tell us what they'd like to see, what's working, what's not working, so we really can develop those relationships and really better the work that we've been doing over the last 5, 10, 15 years.
That's great. Great to hear. We've talked a lot about work, but tell me a little about Nolan. What do you like to do outside of work?
That's a great question. I think when you get into these roles, it's hard not to let work overtake your life. And so one of the reasons that I also took the job and moved here is, as I mentioned earlier on today, I was very involved locally in politics, and I was very involved locally, I'm talking Solano County, Vacaville, in the nonprofit circuit. I was a board member for 3 or 4 nonprofits and always volunteering, going to events and political advocacy things and social advocacy things. And I'm a dad. I've got 2 young boys. I've got a 17-year-old and I've got an 11-year-old. And honestly, I wanted to kind of slim down my life. So I don't have a whole lot of hobbies. My hobby was kind of volunteering and politics. I have kicked those habits to the curb, or those whatever you want to call them, to the curb. And I'm really just focused on being a dad. And so right now, Gus, my 11-year-old bride, and my 17-year-old, and Biscuit, my brand new pound dog, they're my biggest priority. So we're hiking, swimming, fishing. My youngest luckily has my affinity for Star Wars, so we can nerd out on Star Wars together. My oldest loves the outdoors like I love the outdoors, so he's my hiking buddy. And I've got a very cute but very naughty dog named Biscuit, who I'm trying to train and get him to listen a little better. He hasn't quite figured that out. But those are my biggies right now, just focusing on the boys and sort of giving them the time back that honestly I didn't have for them a couple years ago. So whether it's paddleboarding or hanging out, it's something to do with being a dad and kind of exploring something new in Sonoma. Outside of that, I do consider myself a little bit of a Bob Vila. I kind of look like him a little bit with the beard, I guess, as well. Home Depot is probably my favorite store, although I'm really liking Friedman's. We don't have those in Solano. So I'm a bit of a weekend warrior. I love to remodel things and kind of fix things, build things, garden. So the house we bought, much to my wife's chagrin, is a total fixer-upper. But I told her, give me a year or 2 and I'll make it beautiful. So I'll be doing a lot of home improvement projects after I'm done dadding.
Well, that's great. I know you just got to Sonoma County, but what's your favorite thing about the county that you've seen so far?
Oh, that's such a tough question. I think, I guess coming as a visitor, you're so fortunate to live here because there's just so much variety, whether you want to go to Sonoma and kind of check out, the old mission or kind of downtown or kind of the food scene there. Some of the best tacos I've ever had, best Mexican food I've ever had. Bodega Bay, go get some fresh crab, see the sea lions, cool off, Dorn Beach, go hike around. It's just incredible. Right now we're staying in Forestville, and it's just the Russian River is an absolute gem. We paddleboard and swim and hit the river almost every single day. So if you want to go see great redwoods, you got great redwoods. Talk about food. I mean, if you want, good beer, good steak, good dairy, it's all here. Santa Rosa is absolutely gorgeous. Tons of bookstores and little this, that, and the other. Healdsburg's one of my wife's favorite spots. It's a great place for date night. So I just, the variety here is incredible. And there's something for everybody, and there's not something here for you. I don't know where you should go. But it's just an incredible county, and I think it really affords you the ability to be outside and be in nature and do your best to sort of just disconnect a little bit. So big shout out to Sonoma County Parks. I'm an avid consumer, and I have my Parks Pass now of many of your facilities, and we have not run out of things to do or done something twice yet. And I think that streak will probably continue for the next couple of years. So it's a beautiful county with lots of beautiful things to do.
Well, we hope you stick around for a long time and see it all while you're here. So.
Absolutely.
And I know we've barely scratched the surface of the department that you manage. It's so big and vast. We'd love to have you back sometime and talk more about it.
Yeah, I'll be back, and I'll bring friends, and we'll dive in a little deeper. And thank you so much for the time today and the showcase.
Absolutely. Well, thanks so much for being here, Nolan. And as a thank you for being here, we'd love to offer you a SoCo Chat coffee mug
Awesome,
or
thank you.
Water bottle or anything else like that. And to our listeners, we'd also like to give you a chance to win one of our SoCo Chat coffee mugs. Just answer our trivia question, and you'll be entered into our weekly drawing. As a reminder, our question today is, according to the DHS Community Health Dashboard, what is the average life expectancy in Sonoma County? If you know the answer, call us at 707-565-2242 or email us at publicaffairs@sonomacounty.gov. If you submit your answer to us as soon as possible, you'll get a chance to win our prize. Also, if you have comments about this or segment or a suggestion for a future topic for a SoCo Chat episode, please email us at that same address, publicaffairs@sonomacounty.gov. Thank you all, and we hope you continue to follow SoCo Chat on Spotify, Apple Music, Amazon, and of course, YouTube. See you next time. Thanks again, Nolan.
Thank you.